What is holistic treatment for post-traumatic stress disorder? Well, post-traumatic stress disorder is a change to our brain after something shocks me, and then I'll develop all kinds of strategies to manage that. That all gets downloaded into my limbic brain, and whenever something similar happens, it's just like an icon on the computer runs that program. So I keep reliving the trauma again and again and again. So that's what post-traumatic stress disorder is. In order to get that resolved, what we need to do is work with a holistic model. So we know that stress lives in the body because we can feel it. So whenever you have a stressful moment, you feel that in your body. Well, if I have that again and again and again, I condition my body to expect that feeling. So I've got to get that out of my body. It's really, post-traumatic stress disorder is a function of the limbic brain. It's not in my conscious mind. It's not something that I can decide to do or not do. It's not a behavior-oriented thing. It's related to signals that will trigger this program to run. So I can try to isolate myself, and a lot of people do that. They'll stay away from the things that trigger them. But what we're looking to do is disable what the trigger is triggering. So we are able to go in and repattern those limbic brain processes, so we sort of deactivate the trigger. A lot of times when people have post-traumatic stress disorder, they're going to make a lot of adjustments in their life because it's very stressful. It's very challenging. So I begin to have my life be smaller and smaller and smaller. And that then creates its own flavor of pain. And so we have to work on that. And in order to do that, we need to use a holistic model because we are all connected. All the systems of the body are connected. If we look at the science known as functional medicine, and our psychiatrist is a functional medicine doctor. So her job is to not just prescribe something. She knows a lot about how these systems in the bodies work and how when one is out of balance, it will start to kick the other ones out of balance. So it's about correcting the system itself after a trauma. So in order to do that, the program has to be holistic. So to that end, we serve the finest food. We have the most clinical hours of any center that I'm aware of. We're in the finest setting, in very pristine, right outside Sedona, Arizona. It's 4 million people come to Sedona a year just to see the red rocks and be in nature. Our center is immersed in nature. We are a very small center, so it's very intimate and very safe for people with post-traumatic stress disorder. So it's quiet here. We have a lot of staff that live on campus, so there is always somebody around, but there's not somebody kind of always, right on top of you, right? So we have a lot of space, but support when we need it, 24 hours a day. And all of these holistic processes, because we hear a lot about holistic treatment these days, but what we found is if they're not integrated and fit together just the way all the components of our lives fit together, let alone all the components of our bodies and the systems of our bodies, if they don't fit together in a really dovetailed, precise way, they're not going to be as effective. And many people have tried to work out their post-traumatic stress disorder issues by getting some therapy, getting some meds, going to a coach or a counselor, trying this support group, trying various things because people are smart and if they have the resources to do that, but they don't seem to get any better because those processes are all disconnected from each other. Just like a lot of treatment is disconnected from the other parts of treatment. So holistic for us means the whole thing and it's integrated just like we are.